According to the American Medical Association, what percentage of primary care physicians limit the number of Medicare patients in their practice? 5%, 24%, 31%. 31%.
Well, it's great to be here in Virginia. Thank you, Scott, so much for inviting me. And first of all, I'd like to pass on my condolences from both myself, my wife Catherine, and my family to your military community for the tragic loss that this community has just suffered. And we will keep you in our prayers. I was a cardiovascular surgeon until last July of 2010. I campaigned and did surgery both at the same time for about 8 months. And then at the end of July, I took a leave of absence for the last 3 or 4 months. And so I've just recently been in the healthcare arena. I did my last open heart case right at the last week of July 2010. My charge here tonight is to go over the current state of the Medicare program and to give us a little background on why this is such an issue going forward for our country. As you can see, the average couple turning 65 today in their lifetimes has contributed a little over $100,000 to the Medicare program over the course of their life. But because of the increased cost in healthcare and all the technology and things we can do for people today, that same couple will have about $300,000 in benefits over the course of their life. So you can see the issue there. And this, according to the nonpartisan trustee report recently came out, the hospital health insurance, starting in 2020 will start to go bad, and in 2024 will essentially be bankrupt if you look at it from an accounting perspective. That's 4 years sooner than they predicted last year. And the other thing is the hospital insurances outgo the amount of money that's paid out by the hospital insurance board, that's your Medicare Part A, is already exceeding the income that is coming in, and that has been happening already since 2008, and I'll show that in graphic form here. So you can see on the first line, the hospital insurance is what we're talking about. The assets at the end of 2009 were about $304 billion. The income in 2010 was $215, and we paid out almost $248 billion. That's a decrease in the assets of $32.3 billion. So the amount of assets we have left at the end of 2010 is $271.9 billion. If you extrapolate that every year going forward, then we lose about 30 to 35 billion in the program. That's where the 2024 number comes in, where at that point, this top number, the assets, is at 0, and the amount of income is not enough to pay for the program. In fact, probably about 85 to 90% of the outlays at that time will be able to be paid. And what that means is a couple of things, which most likely would happen, potentially a dramatic cut in the outlays, which means benefits potentially to seniors to make up that difference at that time. And that's one of the most concerning things. This is in graphic form. This is a little complicated, but basically look at the blue line and look at the top black line. And you can see starting in 2024 where the black line crosses over the top of the blue line, and as far as the eye can see, there is that gap between the amount of money coming into the program and the amount of outlays that are going to be that it's going to cost us. So that's in graphic form what I just said. And then I want to maybe my last slide's not on there. The other slide I was going to show you was what the total cost of Medicare, Social Security, and Medicaid will do as a percentage of the overall federal budget. And within fairly short order, depends on who does the estimate, within about 15 years or so, those programs will take up the entire U.S. federal budget with no money left for defense, no money left for any other discretionary spending programs. So I think that hopefully has laid out for you why the Medicare program needs to be looked at. And as Dr. Gingrey and Congressman Rigell have already alluded to, if we're going to have this program present for future generations, like my 4 kids, age 18, 16, 13, and 7, as well as Dr. Gingrey's grandchildren and others, we're going to have to make some changes to the program. The numbers don't work, and there's just no way to get around that. And I would like to reiterate what's already been said. Current seniors and anyone over the age of 55, the House budget has the program not changing for any current seniors or anyone over the age of 55. But the reality is, for people like me at age 49, the program is not going to be present if we don't do something to make it better. And I'm very concerned about that. One of the reasons I ran for Congress, coming right out of the medical field, was because I think this issue is still going to be on the forefront and still going to be problematic for our country, I think, for the rest of my lifetime, probably. And I really feel strongly that a perspective of medical professionals as part of the discussion is very helpful to try to figure out compassionate ways to make these programs work for all of us in the future. So with that, I appreciate the invitation. It really is an honor for me to be here. If you would have told me 2 or 3 years ago that I would be doing this in the middle of my cardiovascular surgery practice, and better yet, if you told my wife that I would be doing this, she would have probably called you nuts, because but it truly is an honor and a privilege to be here. So I look forward to your questions. Thank you.
Thank you.